Hi, I'm Dr. Prashantha Kesari, Senior Cosmetic, Plastic Reconstructive and Microvascular Surgeon practicing out of Nypunya Plastic Surgery Team, Bengaluru, India. Latest advancements in facial palsy reconstruction or functional muscle transfers, where we transfer a small muscle called gracilis from the thigh and connect its very tiny blood vessels to the neck, and we put it in such a tension that it actually functions like one of the muscles of the face. This is the most advanced and most beneficial surgical procedure that is there in the world to facial palsy patients, but we have to choose these patients very carefully, and it is a very small percentage of patients will be needing. And other advances are like the intraoperative nerve stimulators have improved our job a lot, so that we can identify which branch is supplying which part and then connect it to a particular source, so that its function gets regained to very precise levels, and there is no cross stimulation of other muscles. So these are the advances that are there in the facial palsy surgery now. See, facial palsy reconstruction is a very delicate job, and it's very important to balance both sides of the face, and there may be need of touch-up procedure, retightening or rebalancing procedures in about 10% to 20% of the times. So you should be very much aware of this. It is, say, some 10,000 times more complicated and more precise than your simple car wheel alignment. So it may need touch-up procedures. And the other thing is like sometimes the nerve which is connected may take longer to grow through and pass the signals, and sometimes the nerves which are connected may not work. So we should have plan B and C when it comes to facial palsy reconstruction. And the most important thing is pre-education and use of physiotherapy and practice from the patient side to recover fully. Because however good the surgery is, if the effort of rehabilitation of the face is not done by the patient, it's not going to work that well. So it's very, very important for doctor and the plastic surgeon and the patient to work as a team in regaining the face function and the confidence of the patient. Recovery time of facial palsy surgery is typically about 5 to 7 days, where there will be swelling and there will be some amount of bruising. And facial palsy results are, when we do functional muscle transfer, are seen as early as second, third week. And when we do neurotization or nerve transfers, it takes months. So we should be very much prepared for these things, and swelling and healing, everything, initial healing gets over in 2 weeks, but the actual functioning of the reconstruction may take longer than that. So it's very important for you to be prepared for a rehab program and to go on trying and putting the best effort till we recover fully.